are going to assess the thorax and lungs. And in this assessment, we will include the posterior and the anterior thorax. So, I am Maria Cristina, your nurse for today. So, we are going to assess your thorax and lungs. So, I am expecting your fully cooperation. Okay? And now, I'm going to ask you, do you have any family history of cancer? Allergies?
No.
Do you take any medication right now?
No.
Okay. So first, we need to inspect the shape and symmetry of the thorax from posterior and lateral views, and then compare the anterior diameter to the transverse diameter. So, thorax is symmetric. And then, next is inspect the spinal alignment for deformities. So, have the client stand from a lateral position, and then observe the three normal curvations, the cervical, thoracic, and then the lumbar. So, the spine is normally aligned. And then next, I'm going to palpate the posterior thorax. So, normal and no swelling or tenderness. Next is I'm going to palpate the posterior chest for respiratory. So, ma'am, can you take a deep breath? So, it's normal since you see my tongue was moved. So, next, I'm going to palpate the chest for vocal permittus. So, I'm going to use my both hands. So, ma'am, can you say the 1, 2, 3 or blue moon?
Blue moon. Blue moon. 1, 2, 3.
So, okay. So, next is I'm going to percuss the thorax and then percuss the diaphragmatic expression. So, ma'am, take a deep breath. You need to let it out and then hold it. I will do some percussion and you take another deep breath and in and hold it and I will percuss it more. Okay, ma'am? Take a deep breath. As I measured, it is 5 centimeter, which is the expected measurement of the diaphragmatic expression. Next is I'm going to ascertain the chest using the flat diagram of the stethoscope. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. So the findings are not normal. So let's proceed to the anterior thorax. First is we need to inspect the breathing pattern. So I can see that the breathing is quiet and it has effortless respiration. And then next is we're going to inspect the costal angle and the angle of which the ribs enter the spine. So costal angle is at 90 degrees, which is normal. Next is we're going to palpate the anterior chest. So it's just normal. And then we're going to palpate the anterior chest for respiratory exclusion. So it's also normal. So, and then we're going to palpate the top permittus in the same manner as the posterior chest. Inhale, exhale, inhale, exhale. So, it's also normal. Next is I'm going to percuss the anterior chest systematically. So, it's just normal. And now, I'm going to locate your trachea using the stethoscope. Now, I'm going to locate the anterior chest. After that, I'm going to decrement it.